Alex Berenson's a former New York Times reporter and author of many books. He's been willing to challenge the consensus to at least explain itself, the shutdown consensus, that is. He now joins us. Alex, thanks for making the time.
Buck, it's a great pleasure.
I have some specifics that I've been looking forward to getting to ask you about. I've been following your work very closely online. Let's just start with this. We have the unemployment numbers that just came in for the most recent week. We're at depression level unemployment. We're heading toward the absolute peak in terms of the Great Depression's highest level of unemployment. We're going to be there in a matter of weeks. What are you going to say at this point when someone asks you, how are we doing in our fight against the virus from a policy level?
We're doing a terrible job right now. We made decisions a month ago on the basis of panic, and I understand that panic. I was actually quite worried, in early March too, and certainly I was paying attention to this. I bet you were, from January on, and some of the numbers out of China looked pretty bad, and and obviously we didn't do much in February when we could have, and then suddenly, these hospitals in northern Italy got overrun. And we panicked, and we shut the whole country down essentially in a matter of weeks. And people warned a month ago. The president of the Federal Reserve of St. Louis warned just how bad things were going to be. But I'm not sure that policymakers either believed him or cared. But in reality, the economic devastation, the societal devastation, the educational devastation here has been off the charts. It's been impossible really to measure by any any of the metrics we have. It's off the charts, and it's not just in the U.S. by the way. It's in Europe, and it's really, as far as I can tell, I don't know that we've ever had a synchronized worldwide slowdown in economic growth like this. Maybe the Great Depression. I guess you'd have to be an economic historian to know. So we've done all this, and we've pushed harder and harder. And at the same time, there's less and less evidence that this virus is some kind of societal threat. That's not to say that that the coronavirus is not real. That's not to say that the coronavirus can't kill people. That's not to say that it isn't particularly dangerous to elderly people and people in nursing homes. That's quite clear. The evidence is if it gets into a nursing home, it can kill a lot of people pretty quickly. But the evidence now is overwhelming that this is not very dangerous to people under 30. I mean, to them, there's almost no risk. To people under 50 who don't have comorbidities, and even into people who are somewhat older who don't have a lot of, other medical problems. And the media is not reporting that. They're not reporting who's really getting sick and dying here. They're not reporting that outside of New York City, hospitals in the United States are emptying out, that hospitals in the United States are losing money because they are so empty right now. They are not reporting the truth about what's going on. And the hysteria is terrible, and the economic devastation is worse.
Now let's look specifically at the primary claim here that you're hearing from, and I call it the lockdown consensus. I mean, however one wants to phrase it, but that's what we've been dealing with. The consensus for a few weeks, as much as there can be on these things, has been lockdown, lockdown, lockdown. Okay. Sure. Does it work? Given that the alternative, and this was the false choice we were offered, it was either lockdown or you want to watch Granny die for your 401k. I'm sure you've seen a lot of that. I've seen some of the ugly stuff online. I'm sure you've been subject to it. I know I have. Anyone who wanted to raise any questions, the real issue would be lockdown versus other measures short of shutting down the economy. What evidence is there that lockdowns do not work as they have been advertised?
Okay, so this is a great question, and it takes a little while to unpack. So let me start with what were the lockdowns supposed to do? Okay, the lockdowns initially, nobody said the lockdowns are going to prevent everyone from getting infected. Okay, the idea is this is a new virus, and it's going to spread, and some people are going to get sick from it. The idea of the lockdowns was, quote unquote, flatten the curve. What did that really mean? It meant spread out the impact on the healthcare system. So the idea was what we don't want is what happened in Italy. What we don't want is hospitals that are overrun with, tens of thousands or thousands of elderly people and can't do their jobs. And doctors and nurses and medical staff are heroic, but they're working themselves to death. And we are losing hospitals. Okay, that was the promise of the lockdowns was not everyone's going to live forever and no one's ever going to get coronavirus. It was, we're going to stretch this out. Okay, even on that basis. So let's say that actually did work as promised. The economic devastation here, now that we know that this virus is not as dangerous as we thought it was a month ago, I think has to be weighed against this idea of health system disruption. But there's an even more important point, which is we haven't seen any health system disruption. So the lockdown, so then people will say, okay, well, we haven't seen health system disruption because of the lockdowns. But that's not true either. And the proof of that, and this is where I sort of got, started to get heard from about 2 to 3 weeks ago, is that there was this model, which is still around, called the University of Washington model, which charted deaths and hospitalizations on a daily basis in the United States. And it said, this is how many people are going to be hospitalized from COVID every day. This is how many people are going to need ICUs. This is how many people are going to die. And that was completely wrong in real time. That model was released on March 26th, and within a week to 10 days, it was predicting 4 times as many hospital beds would be needed as were actually needed. Not in the future, on a day-to-day basis, it was that wrong. And it's really important, Buck, to understand why it was so wrong. It was so wrong because the assumption that the modelers had made was that the lockdowns had come in too late, that there was going to be this huge surge of cases that sort of people they get sick, they get infected, then they show symptoms a few days later, then they wind up in the hospital a few days after that, then they wind up in an ICU, then maybe they die, okay? And that process doesn't happen overnight. It takes somewhere around 3 weeks. It could be 2 weeks for one person, it could be 3 weeks for another, it could be 4 weeks for another. But ultimately, the theory was there's a ton of people who were infected before the lockdowns came into place, and they are really going to cause a huge problem. It didn't happen. And we still don't quite know why it didn't happen. But there's no way to look at that data and say it's because the lockdowns helped us. That's not what the data says. What the data says is that at best, the lockdowns were irrelevant.
Hey Team Buck, thank you so much for watching The First on YouTube. If you like this video, please click that little thumbs up button so then it will log as liked. And also, if you want to see more great content from The First, please click subscribe.